Post-Pandemic Blues, December 8th, 2022. Good afternoon, ladies and gentlemen. Thank you for being here today. My name is Angela Gentile, and I'm a clinical social worker. I'm a therapist, and I specialize in working with older adults and their families. I would like to thank Home Care Assistance for sponsoring me today. Please take some time to look at their brochures if you are in need of any personal assistance. I would like to tell you about the post-pandemic blues and ways that the COVID-19 pandemic has affected us and what we can do about it. I will try and keep this talk down to a half hour, but I've learned so much in preparation for this talk today. This is just a small fraction of what I have learned and read about. I hope to get some audience participation, so please feel free to share a story when you are prompted. In March 2020, almost 3 years ago, our lives and our world as we knew it changed. Here in Manitoba, we have seen over 150,000 cases and approximately 2,300 deaths related to the COVID pandemic. I call this talk post-pandemic, but as we all know, it isn't over yet. We are living through a traumatic event in world history. I was working for the WRHA at the time the pandemic hit. My doctor warned me that due to a pre-existing health condition, I was at greater risk of having an adverse outcome if I caught the COVID-19 virus. I immediately went into survival mode and wanted to stop seeing clients and other people in fear of catching the virus. It was quite stressful for me. I'm sure everyone has some memories of how they felt at the beginning of the pandemic. One woman was quite fearful. Perhaps you can relate. A woman explains. Our friend Ruth had positioned herself about 20 feet away from us, looking like she might bolt for shelter at any moment. She was preciously paranoid about the pandemic. Another woman told me about a time she went into the grocery store with her mask on. They had put yellow directional arrows on the floor. The aisle was empty, so she started walking down the aisle in the wrong direction, thinking no one would even notice. Then all of a sudden, another masked woman started walking up the aisle towards her. They made eye contact. The woman, walking in the correct direction, said to her in an angry tone, "You're the reason why this pandemic is spreading." I felt like she was accusing me of killing people because I wasn't kowtowing to the yellow arrows. I hated those arrows. It was such a weird feeling. I felt like I was in a prison camp when we were waiting in line outside the grocery store. We had to wait outside and stand on markers that were spaced 6 feet apart. I said to the other person, another person standing there, "I feel like I'm in a prison camp." And the other person said, "Yeah, that's about it." We had to wait. They could only have 30 people in the store at a time. We had to wait for one person to come out so another person could go in. I don't know. I didn't know how long those rules would last or if this was our new lifestyle. The day Winnipeg went into a state of emergency on March 20th, 2020, was my 54th birthday. I remember having to cancel my plans to go out for dinner with my family. I have a photo of myself, my husband, my daughter, and her boyfriend at the time. I was sitting in front of a birthday cake at our kitchen table. It was a strange time indeed. Does anyone want to share how they felt back in the early days of the pandemic in 2020? In addition to carrying our residual feelings of the lockdowns and other losses we endured during that time, we should also reflect on a few other facts that could be affecting our mood. Not everyone is celebrating or looking forward to the holidays. Christmas and other celebrations at this time of year are not the same for people who have lost loved ones. It's a sad reminder that those who were near and dear to us are no longer around to partake in the festivities. It can be a very sad and lonesome time for some people. Seasonal depression or seasonal affective disorder, also known as SAD, can set in for those who are susceptible to the reduced daylight hours as we head into winter. Not to mention, Ukraine is at war. There's a political unrest in the USA. Our climate is in crisis, and George Floyd's horrific death. Right here in Winnipeg, Dr. Jatinder Sareen, head of the psychiatry department at the University of Manitoba, has stated, "We are in the middle of a mental health pandemic." Are there any other factors that could be causing us to feel blue? So let's talk specifically about the COVID-19 pandemic. COVID was first detected in late 2019 in Wuhan, China. 3 years later, after many mutations, it has killed at least 6.6 million people worldwide and sickened almost 650 million. The world is now trying to live with COVID. Just like the common cold or the annual flu, perhaps COVID-19 is here to stay. Where does that leave us? Doctors have reported that the pandemic has caused emotional distress. They have also seen an uptick in anxiety and depression. They also saw more patients for problems with alcohol consumption and sleep disorders. One woman told me, during the COVID-ly times, I had an over-the-phone appointment with my doctor. She had to renew my prescriptions. She told me she could not renew my sleeping pill I had been taking for 25 years. Not good. It seems that too many people were taking it now, so now no one can get it. I guess the pandemic produces insomnia in the general population. More breakups and divorces were reported during the pandemic. Couples were forced to spend more time at home together, such as working from home. Some lost their jobs. It was stressful to have children learning from home. Some parents learned they didn't see eye to eye on parenting issues. Perhaps they disagreed on meals, homework, or vaccinations. These factors caused the likelihood of more conflict, and in many cases, partners looking for a way out. What the pandemic has left in its wake is a multitude of social, emotional, and physical problems that we are all trying to navigate through. Many of us who have survived and lived through the first 2.5 years of the pandemic are still feeling the effects of what the social distancing, quarantining, constant fear of getting the virus and being kept from our dearest family and friends has done to us. Some of us turn to increased substance use such as alcohol or marijuana to cope with this stress or emotions related to the pandemic. Returning to normal for many might mean addressing mental health challenges that intensified or arose during the pandemic. One older woman who lives in a condominium complex writes, "Myself and 3 other ladies on the 3rd floor would sit in our separate doorways, legally still in our own home, and sip our wine or beer with conviviality in the hallway, letting the COVID-19 world fade into an alcoholic haze. Our chairs started inching closer and closer." She then continues, "And sometimes we said goodnight with a hug, a COVID no, a matter of trust, knowing each of us were being very careful away from the hall so that in the hall we could be safe. During the year of COVID, when social distancing was paramount and people avoided people like the plague, a hug felt really good. Important stuff, the occasional hug. Honestly, being plotzed had nothing to do with it, LOL." Laugh out loud. Our personal appearance was affected when salons were closed. This in turn affected our self-esteem and self-image. I remember one time I posted a picture of myself, a selfie, on Facebook, and I called it, "COVID hair, I don't care." Those of us who worked at keeping ourselves looking put together found ourselves embracing our natural appearance as the pampering, such as getting our nails and hair done, weren't available. Gyms were closed, so we had to figure out how to keep up our exercise routine or abandon it altogether. We started wearing comfy clothes, and some of us enjoyed wearing more comfortable undergarments, such as wireless bras. Others turned to impulse buying, pandemic retail therapy, as quoted by one woman. Online shopping, home delivery, and curbside pickup made it very easy to buy things. A quick little pick-me-up was easily attained and proved to be a remedy for someone in the doldrums. A woman continues to explain, "Both of my friends are so clever at decorating. They do HomeSense. I do Goodwill. Don't laugh. I have 2 rescued paintings from there now. One is a huge abstract modern art picture depicting, I think, ethnic musicians on LSD. Very colorful and making no sense. I call it my pandemic picture. I'll get rid of it once this pandemic is gone. Maybe. My husband and I were disappointed twice in a row when we learned we weren't able to travel to Florida for a warm winter vacation. So we decided to put the money into one of those electric massage chairs. We affectionately call it our pandemic chair. It is well used, by the way. What did you or someone you know acquire during the pandemic lockdown? Some of us ate a lot. There was a running joke. I have the COVID-19, meaning that they had gained 19 pounds. A report from the USA states that 42% of people had gained weight during the pandemic. An undesired average weight gain of almost 30 pounds. Eating too much and disordered eating were unhealthy ways we coped with the stress of the pandemic. A woman writes, "We got full on chips and dip and reminisced about past Fridays and declared we had done the year of living COVIDly proud." Delayed treatment, diagnosis, and postponed surgeries. Now we deal with even longer wait lists. Could this also affect our overall well-being and mental health? Even though we tried to have fun and go on with a normal type of life, we had much difficulty. One woman writes, It was a strange summer at the lake. COVID hung like a bad smell." And who would have imagined how the introduction of COVID-19 vaccines would have caused so much controversy? Families and friends were torn apart due to their differing opinions and beliefs about getting vaccinated. In some cases, these polarizing opinions caused irreparable harm. A research article published in July of 2022 indicated that there was an increased trend of suicide attempts reported during 2020 and 2021. The mental health impact of many factors such as social distancing, COVID-19, quarantine, domestic conflicts and violence, financial loss, anxiety and depression, and pre-existing mental health conditions were all factors in this increased trend of suicide attempts. I can only imagine that flight and travel restrictions and being separated from family and close loved ones made it even worse. Statistics Canada has also done some studies, and it was found that there was an increase in suicidal ideation during the second year of COVID-19 pandemic. Those most affected were both males and females younger than 65, born in Canada, had lower educational attainment, or were never married. Many people suffered with anxiety and depression. Youth and children have been particularly affected due to being isolated from family and friends and having to move their schooling to online learning. In fact, one young fellow told his grandfather that he missed grade 4. Many of these young people are struggling and are behind now in their education as well as social skills. People who had been previously diagnosed and or treated for anxiety or depression may have found their coping skills went by the wayside, only to have their symptoms flare up. Some folks who had never had mental health problems suddenly found themselves struggling with anxiety or depression. Funerals were taken online. People who didn't have access to or have a good working knowledge of technology were left in the dark. People weren't able to grieve as they normally should. The bereaved were robbed of the support and love they needed to help them cope through their very difficult times. I remember one middle-aged woman telling me she visited her dying mother in the hospital who had COVID, and she had to sneak a kiss and a hug. She says there was no way she was going to follow the no-contact rules at such a difficult and sad time in their lives. Small businesses were hit hard. Travel was extremely limited. Weddings weren't celebrated in the ways they should have been. Babies and their parents didn't get a proper celebration and welcome into the world. Graduations, birthdays, retirements, and other special milestones were not celebrated in the traditional sense. Drive-by parades, telephone calls, Zoom visits, window visits, driveway and front yard visits were the best we could do. Many of us have been robbed of these memories and special moments, and it is sad. People who were searching for love and relationships had a tough time too. Those who lived alone were even more lonesome. Some of us were lucky to be living in the same household with people we enjoyed being with. Others immersed themselves in projects such as searching for toilet paper, Lysol wipes, or hand sanitizer. racing to get them before the hoarders did. My husband was able to continue working outside the home during the pandemic as he works in healthcare. He was able to do the shopping on his way home from work or early on Sundays. Healthcare workers and older adults had special privileges and got into the stores by getting in earlier or in a special line that moved quicker. I worked on my family tree. I interviewed many family members on the phone. I went through my photographs and discarded some photos that were duplicates, blurry, or just not meaningful to me anymore. I got rid of old journals and diaries, and I even ventured into taking photos of grave sites here in Winnipeg for loved ones from afar. I took up a new hobby of making jewelry. I finished and published my 6th book during the pandemic lockdown of 2021. I brought some of my books, and they are for sale if you're interested in taking a look. I know others who turned to writing too. I didn't get depressed, but I sure was scared and anxious at times because I didn't want to get sick. What did you do to help pass the time during lockdowns? Those 2.5 years have flown by. They say time flies when you're having fun. I don't think many would say life was fun in 2020 or 2021. The reason why time flew by is because we have little to nothing much to remember or to help us remember that time. Some say it was lost time. Some people have a lost sense of timing. They may say to their friend, "Oh, that happened about 3 years ago." Then someone pipes in and says, "No, actually that was about 5 years ago." Our perception of time has become skewed. People broke the rules because they wanted to have connection with others. I know of one situation where people had secret visits with their best friends. What they would do is move their car out of the garage so their friends could drive in and quickly close the garage so no one would see there was a visitor to their home. Getting a fine for having a much-needed visit to see their closest friends was the risk they were taking. People adopted pets. Now the pet shelters are bursting with young dogs who have been surrendered, who are too anxious to stay at home alone now that their owners are back to the office. Many of us got COVID-19 despite our efforts to avoid it. Depending on vaccination status, remember vaccine passports, and pre-existing health status, the course of illness varied widely. Studies have also shown that those who have had a COVID-19 infection are at a higher risk for experiencing anxiety, depression, and dementia. Approximately 1 in 5 can develop a psychiatric illness within 3 months of diagnosis. People in Ecuador infected with COVID-19 commonly express feelings of anxiety, depression, insomnia, and post-traumatic stress disorder. Pandemic stress, plus the physical symptoms of having COVID-19, can increase the risk of mental health problems. Some of us got sick after we had the vaccine. Was it an adverse side effect of the shot or just coincidental timing? Some of our loved ones did not make it through this horrible, lonely time. Others, about 15%, who had contracted the virus had to live with the effects called long COVID, which could have lasted weeks or months. On March 15, 2022, after many rounds of vaccinations and 2 years of public health restrictions, we were told by the Manitoba health authorities that it was okay to go out again and we needed to learn how to live with COVID. Restrictions were lifted. Countries and communities around the world were finding their way too. This announcement came also after we had some very vocal and physically present freedom convoys popping up all around the nation. Protests and blockades crippled the Canadian capital. Coincidence or not? The pandemic has left us with many questions. The research coming out will help give us some answers and insight. Is there any memory of the pandemic you would like to share? I would like to read you a poem. 2020 in Hindsight. This was written by Charla Kinsman, Abstract Reflections, on June 18, 2021. Wash your hands and wear a mask. Social distance when you're out. Stay at home if you are sick. That's what prevention is about. Ignore advice from public health and refuse to follow rules. The outbreaks of infections being spread by selfish fools. Elderly and seniors' homes are suffering from neglect, understaffed with lack of care, treated without respect. Fear of dying all alone with no one by their side. Loneliness and heartache, pain and sadness as they died. Families have been broken, friends feel far away. People are left standing alone another day. Depression and anxiety cause a pain felt deep inside. Too many people have been lost that died of suicide. Out of work, losing hope, the fear and anger grows. Record profit for Amazon, small businesses have to close. Market crash, short on cash, unemployment causes stress. Money spent, savings gone, we will learn to live with less. Body bags in mass graves, they incinerate the dead. Mothers cry as children die, and statistics track the spread. As medical supplies were running out because of an increase in demand, companies had to step up and manufacturers had to expand. Production lines were redesigned to complete important tasks. Ford was making ventilators and GM was making masks. Development of new vaccines being done at record speed, combining forces to reach a goal and work together to succeed. Anti-vaxxers don't seem to trust in what science has to say. There is no truth to rumors about it changing DNA. Celebrations have been cancelled, weddings are postponed, funerals are live streamed so you can watch them on your phone. Airlines have to cancel flights and the global tension grows. Travelers want to get back home as the borders start to close. Find a hobby, read a book, watch a movie on your phone. The boredom keeps on growing, spending too much time alone. Watching Netflix, wasting time as the day keeps dragging on. So much time has disappeared, not sure where it has gone. No wonder we are sad. We have lost so much. We have been through so much. Disappointment after disappointment. So how do we come out of this? How do we honor those whose lives were lost? How do we acknowledge those events and milestones that went unacknowledged? The youth and children in their very formative development era lost years that they will never get back. Perhaps you know someone who lives in FONO, F-O-N-O. FONO stands for fear of normal. Some of us have been living in fear for 2 years already. How do we just turn off that fear? Staying indoors in our COVID cave of safety to avoid catching the virus may seem like a safer option. Getting back out into public, living with the virus, getting back to normal may take a while for some of us. Psychologist Deborah Serrani shared, this is a global example of what's called re-entry after trauma. I know we have to be kind to each other as we emerge from our safe places. Some of us fear another pandemic, another wave, another mutation of the deadly virus. First, COVID hit our seniors in nursing homes. Now flus and other viruses such as RSV are now attacking us and the children are suffering. I heard one parent say, the teachers tell us to send our kids to school because if we don't, they will fall behind. Our government is encouraging flu vaccinations for children. Reflecting on what the heck happened to us from 2020 to the present day helps us acknowledge that it was a strange time in history. One of the first things I do when I am faced with something new and scary is I read as much as I can about the subject. In my case, I had read about the Spanish flu of 1918 that took my grandfather's father and sister right here in Winnipeg. Having an understanding of something can certainly help me cope with it. I think it will take some time for us to regain a healthy sense of total well-being again. We have certainly learned a lot about viruses, masks, vaccinations, hand washing, social distancing, staying home when we're sick, and other things we can do to help keep ourselves and others healthy. Now that we have the physical health practices licked, I think we need to turn to the emotional well-being. I read in the Winnipeg Free Press that a panel of 386 experts came together to release a report on how to end the public health COVID-19 crisis. Their near unanimous agreement is that indoor areas with poor ventilation pose the highest risk. These experts recommend, in order to have both an immediate and long-lasting impact, structural prevention measures such as ventilation and air filtration should be incentivized by governments, and a high priority should be given to preventing transmission in the workplace, educational institutions, and commercial centers. Just like we know how important clean drinking water is, we must now focus on clean, healthy air. This is a big job for the powers that be, so I hope they take heed and implement the changes as soon as feasibly possible. There's no magic potion that will help us come out of this. At least I haven't heard of it. Here's what I suggest. Reflect on your own pandemic experience. Acknowledge that you are now living in the wake of a very tumultuous and strange time in our lives. In the history of the world, even shaking hands or giving hugs weren't allowed or encouraged. I know of people in Australia who are faced with being shot in the back with rubber bullets the size of tennis balls for protesting harsh lockdowns and curfews. We were all starved for affection. Talk to others about what they miss the most. You will soon find out you're not alone in your experience. Focus on what's good in your life. Find 3 things you're grateful for or what brings you joy every day. Get yourself a nice journal and write it down. Being thankful for those people or things in our lives that are good can help us cope, even if it's as simple as a new pillow or a phone call from a relative. Get outside, or at least get natural daylight every day. Sit by a window and let the sunlight bathe you as you read or listen to relaxing music. Fresh air and sunshine can do wonders for our mental health. Gather with a few friends or people who are supportive. Socializing and fostering connections with others does our soul good. Find things to laugh about, share jokes, watch funny movies, read a good book, spend time with young children or people that make you giggle. Exercise on a regular basis. Walking is the easiest form of exercise for most, and all it takes is a good pair of walking shoes. If you feel at all depressed or anxious and you feel you need some professional help, talk to a healthcare provider or a mental health clinician. In my practice, I've counseled people who have experienced great loss and suffering over the pandemic years. Sometimes people need some medication to help them over the hump. Don't be afraid to ask. If you're still not feeling like yourself and you are not willing or ready to go see a doctor or therapist in person, there has been a surge in telehealth and teletherapy. The restrictions the pandemic placed on us created opportunities in some cases. Now it is easier to see and talk to someone over video, which is almost as good as being there in person. It is proven to be quite effective. For example, I am a clinical social worker and I have a virtual video counseling service option available. Many have used it and I think it's here to stay. When you are ready, plan that vacation. Plan that getaway if you haven't already. I know for myself, I love cruising. However, the thought of being housed on a ship with thousands of people does not appeal to me right now. I think to myself, I'm not sure if I want to be around all those people. What if I get sick and I have to be quarantined in my small cabin? What if our ship gets stranded and we're not able to get off it like those people at the beginning of the pandemic? I think it may be a while before I feel comfortable to get back on a cruise ship. But like many other times, I may all of a sudden decide, why am I putting my life on hold because of this stupid virus? Lots of people don't care anymore. Maybe I shouldn't care either. Finally, let's have hope. Hope that things are going to get better. Hope that this will all be but a bad memory that we can all put behind us, much like they did more than 100 years ago after the flu pandemic of 1918. Thank you for listening.